scientifically speaking, like if we're just talking about like the way a woman's body works, it takes 18 months. And an athlete told me this, a really amazing athlete told me this. It takes 18 months for a woman's body to recover from birth. Hormonally, there's a lot going on in our body. The pregnancy hormones with the postpartum hormones, for everything to balance out, for that chemical shift to balance out. I've been through my fair share of postpartum therapy, so I know that like it really takes time. You know what I mean? So it's unrealistic expectations. And then it just makes us feel like worse mothers. We have to be so hard on ourselves. We have to guilt ourselves. There's already enough of that.
Giving birth is one of the most significant events of your life. Sadly, the joy that you should feel can often be replaced with anxiety and helplessness instead. As a labor and delivery nurse, I'm revealing insider information to educate you, reassure you, and decrease your fear. In this podcast, you'll hear empowering birth stories and experts weigh in on a range of topics. Being Jewish also has me exploring Judaism's influence on the reproductive experience. However, I speak to anyone wishing to navigate their journey with more joy and confidence. I'm your host, Chani Fingerer, and you're listening to the Happy Birthway Podcast. Welcome to episode 39 of the Happy Birthway Podcast. I am so excited to bring you a phenomenal interview with Sarah Isaacs for this episode. Sarah is a perinatal fitness instructor, and we had such a great conversation that at the end of it, I forgot to ask her to tell all of you how you can find her. And the way you can find her is simple. It's on Instagram, Sarah Isaacs _. So that's SARAHISAACS _ on Instagram, and you can DM her there as well. And I will, as usual, put this info in my episode show notes. Now, trigger warning, before we start the interview, Sarah does talk about her recent miscarriage. And if you feel like that might be distressful for you, then this is probably not the episode for you. But I have 38 more wonderful episodes. So if you didn't listen to all of them, then you might want to check them out. And I have many more great ones coming up. And I cannot end an introduction to an episode without thanking you again for your ratings and reviews and my offer of 20% off my After the Birth course or 90 days of free membership to Yoledet community still stands for anyone who reviews the podcast on Apple Podcasts. So just snap a picture of it, email it to me at chani@yoledetacademy.com, and let me know which offer you would like, and I will send it to you. I hope you love listening to this interview as much as I loved doing it. If you like it, please don't forget to share it and subscribe to the podcast for more great interviews like this one. Today, I am so excited to be interviewing Sarah Isaacs. Sarah is a personal trainer. She's a pre- and postnatal exercise specialist, Pilates instructor, avid runner, and all things fitness, and a mother of 3 little humans. Sarah, welcome to the show.
Thank you, Chani, for having me. I'm so excited to be here.
It's absolutely an honor. I actually love following your Instagram page, and I've learned a lot from you, and I love your approach to fitness during this perinatal phase of someone's life and how you just keep it very real. So let's get started. Can you tell us a little bit about how you entered the fitness world in general, and then how you decided to choose the perinatal, the pre and postnatal phase of life as your specialty?
So I have been working out since I was 16. I got kicked out of a vert class when I was in high school, and because I had so much energy, and my principal said, you should go use your energy for something useful. And I've been working out since. It's just been a passion of mine. I tried to do the college thing, but everything always comes back to fitness for me. It's always been a healthy outlet. I love to empower women and to help them feel strong. And I have a ton of energy, and it's just been something that it's my calling. It's my calling. It's what I love. I've been a trainer since I was 18, and I always loved the Pilates, like relax. It was like relaxing for me, like yoga's relaxing for people or like massages. So Pilates was like, yoga's too relaxing. Pilates was like the most relaxing. So like, I guess that's why I do Pilates, but I've always taught since I was 18 years old. I've been teaching Tabata classes, which is like a high intensity workout class back in Atlanta, Georgia, where I'm from. And then I got married and I took those classes and training to Israel. And when I was in Israel, before I was pregnant with my first, I had a lot of postpartum mothers, and they would say things to me like, why does my stomach look like this when I'm doing a sit up, or I'm peeing when I'm jumping? And I like literally made it up. Like I made up answers, and I even admit it to them now. I'm like, oh, it's normal. It's okay. Or like, oh, it's okay if your stomach looks like that. Everybody's stomach looks like that. And I really had no idea, because as a personal trainer, you're not really taught anything about women's health or the women's body and what it goes through when you're pregnant and then after birth, because like your body goes through like this tremendous trauma. I hate to say it in like a negative way, but it is a trauma to the body. So I remember that like I literally had no idea. And I said to one of my friends, I was like, I need to know these answers because it's driving me crazy. And it does not make sense that it's normal, because it's not normal. Fast forward to, I think I was pregnant with my second, or postpartum with my second. My core was a mess, and I'm very competitive with myself. And I knew that like, I knew that something was wrong, and I didn't know what to do about it, because I was moving from Israel to Chicago, and I was dealing with a lot of like just postpartum depression and anxiety, which we could get to in a minute. And I saw tons of different certifications, and I decided that like I don't know the answers to these questions, and my body is going through this. So it started off with me just wanting to know the answers and me wanting to help people, because I had no idea how to help them. And also like my own body was a mess, and I was peeing when I was jumping, and I had coning in my stomach, and I didn't know what to do with that. And I felt that like weak core with each baby. Yes, I was running, and yes, I was working out, and I had that whole like, I'm so fit and I'm so awesome thing going. But like internally, my body was a mess. So I needed to figure out the answers to all those questions. And when I was pregnant with my third, I have 3 kids very close together. So yes, it literally, I'm saying it like it is, meaning like every child was like the next year. I became certified in pre and postnatal exercise. It's specifically corrective exercise, which means it's not exercise. It's corrective exercise. If somebody has low back pain, if somebody has a gap in their abdominals, which is called diastasis recti, if someone has incontinence, which is peeing when you're jumping, those types of things, it's a very specific way of almost like physical therapy, but a little bit more intense. And it's been amazing. Like I really do find that I found my niche, because also, again, I went through it. I'm not just preaching. I know what it feels like to feel like your core and your back and your body has been wrecked. And then coming from that and really doing those exercises and helping women and seeing the change. Like, Sarah, I have never in the past 7 years been able to sit up without feeling like my back is going to break. I have not been able to jump or sneeze without feeling like I'm going to pee in 3 years. Like that's what gives me joy, you know? So yeah, I guess like that's my little journey to where I'm at right now. And I love it.
Wow. Yes. And I say this over and over again in so many of my episodes. A lot of times the interest in specializing in this field of perinatal services really comes from someone's personal experience of giving birth and then seeing what that entails and knowing firsthand what the challenges are. So
Yeah.
that, makes a lot of sense. Makes a lot of sense. I love how you mentioned the corrective fitness piece. I think a lot of times when people think about, especially postnatal fitness, postpartum fitness, they think about, let's bounce back to my body. Let me lose all that weight. Let me get back, let me get back my abdominal muscles, and my stomach should look the same that it was. And everything should go back into place. And I want to tone my body, all of that stuff. And I know that just from following you, you come from a place of compassion, and that's not the primary reason of why you do what you do.
Yeah, it's so funny. First of all, I love this question because I coach for Spirit Fit Life. And a lot of our approach is the self-love piece. And I always say to people, like, I think one of my number one thing I say to people, I say, like, does it make you feel good and motivated and inspired when you say, ugh, look at these rolls of fat. Ugh, my stomach, it looks like this. I'm so fat. I need to work out. I need to diet. I need to do this. Does that inspire you? Like seriously, because I'm not inspired. Actually, it makes me feel horrible about myself when I say that. When I look at my stomach, even just the way I'm sitting, and I see that my stomach is rolled or whatever, it does not make me want to go run 5 miles. You know what I mean? It does not make me want to go work out. It actually makes me feel horrible about myself. But when you come from a place of like, oh my God, Sarah, you can do hard things and you are strong, and this makes you feel good. You may not like working out. It does not feel good to work hard, but that after feeling, holy cow, you feel like $1,000,000. You know what I mean? So yeah, when we talk like we are amazing and beautiful and we are so strong, moms, holy cow, what we go through is incredible. That's inspiring. That's motivating. Being unkind to ourselves is not motivating. It makes us feel so much worse about ourselves. And I know it because I'm like you. You know what I mean? Like I always say that. I'm like, I am exactly like you. My clients, I don't want them ever to feel like they are less than, like it is so out of their reach. Like I really try to make it relatable because it's hard. First of all, no one ever said it was easy to accomplish goals. You said something amazing, and I really want to like focus on this for a second. I want to talk about it. Bouncing back. Scientifically speaking, like if we're just talking about like the way a woman's body works, it takes 18 months. And an athlete told me this, a really amazing athlete told me this. It takes 18 months for a woman's body to recover from birth. Hormonally, there's a lot going on in our body. The pregnancy hormones with the postpartum hormones, for everything to balance out, for that chemical shift to balance out. I've been through my fair share of postpartum therapy, so I know that like it really takes time. You know what I mean? So it's unrealistic expectations. And then it just makes us feel like worse mothers. We have to be so hard on ourselves. We have to guilt ourselves. There's already enough of that. Our poor bodies have, first of all, done an incredible mace. It's remarkable that a baby grew inside of us for 9 months. We pushed it out or gave birth to it in whatever form. And then our body had to go through that trauma of not having it in our body anymore. And now you want your stomach to go back. It's like comical, right?
Yeah, it really is. Yeah. And I have to echo what you said about the taking 18 months. Research shows that it takes somewhere between 18 months to 2 years. And I, as an educator, tell that to moms for the body to recover from birth in all ways. So to replenish its nutrients and to recover physically and emotionally, hormonally. And so, yes, that really does play into the fitness considerations and the movement considerations and the strength abilities of the body. So that's really interesting. And I have to also address what you said about is it comfortable to run? No. Say someone likes running. I hate running. I'm just telling you. I I tried it and I just had knee pain, and I actually am huge Pilates, yoga, bar person. Like that stuff.
Yes.
Strength training is my thing. So I I have to say that I liken labor exactly to that. There's a difference between pain and suffering. And I give this exact example to people who are kind of, maybe entering the threshold of motherhood and pregnant with their first, or have had already babies and maybe don't want an epidural again, where there's pain, but it's a purposeful pain. And I always say, when someone's working out and they're motivated and they want to work out and they set a goal for themselves, yes, they're experiencing pain. It's painful to train as an athlete, to train for a marathon, to do exercise, but there's a purpose to it. You're not suffering from it. And that's so funny that you just mentioned that, because that's exactly it. It might be pain, but it's not suffering. It's something that you have to choose for yourself and feel a purpose in it, and not view it as like, oh my God, I have to do this because I'm disgusting and my body is gross. But from a place of like, no, I choose to set goals for myself and I want to meet those goals, and they will not be easy necessarily, but I can do the hard work. And that's really a mindset that I always tell patients with when it comes to labor.
Yeah, it's amazing. I mean, I just think about, I ran a marathon. I have birthed 3 children. I did 2 without an epidural. And not that like there's anything wrong with an epidural. I would do it again. Whatever, side point. But I think about it all the time. Like, birth is a marathon. And we need to treat our bodies with rest and recovery and replenishing its storages, like you said. And I'm on like this off season now after our marathon. It takes time. It takes time. And we're so hard on our bodies. Like, it's like, catch a breath. Take a break. You know what I mean? And I don't know why that is. Maybe because there's a lot of social media or headlines, or like this I don't know, this piece in the, I don't know where people get it from, that like we have to bounce back. I guess there are a lot of headlines, lots of magazines where, oh my gosh, she looks amazing, or look at her, she's out and about doing this and that and whatever. First of all, you don't live her life. You don't know what's going on there. And stay in your lane and focus on you. That's what's going to bring you happiness. That's what's going to help you eventually accomplish those goals, right? Like you just said, setting those goals and accomplishing them. That's what it's about. When we focus on that, it brings us so much more happiness, you know?
Yeah, it's the snapback culture is what it's called, the postpartum snapback culture. And it's like a race. The sooner you bounce back. And unfortunately, it's also been fueled by what we see on social media and celebrities posting post-baby pictures of themselves and everybody commenting, wow, you look amazing. And it's people equate it to having it together in life. When you look like you did before you had a baby, then you must have it all together, like you said. And
I love that one. It is such a lot.
You must be coping really, really well. Like if you can get your body back, never mind that it's genetic or that somebody may have massive anxiety, so they're not eating. Never mind all of that. You know, you must have it together. You must be doing just fine just because of the outward appearances. And you are somebody who just knows really, really well that couldn't be further from the truth.
I mean, I think that I don't like to say it's not black and white, right? Like it's really not black and white. Some people really do. At least me, I'm the type of person that like, I don't want to wallow in my sadness. I don't want to wallow in my sadness. I want to focus on the things that I can accomplish and I can do. And when I'm out and about and having a good time, I don't want to come off as like a sad person. It's not faking it. It just means that I'm focusing on, the positive. But then, yeah, we also, a lot of mothers So many women after birth really struggle with anxiety, with depression. And there's nothing wrong with it. First of all, your hormones are balancing out. Sometimes it takes 6 weeks, and sometimes it could take 6 months. And that's okay. That's why, first of all, it's not new. Women thousands of years ago went through the same thing. And we are so grateful, at least I'm so grateful, that people talked about it, and that there's medication, and that there's therapy, and that exercise has always been a therapeutic outlet for me.
Not just for you. I mean, it's shown to increase the manufacturing of endorphins, healthy hormones that are great for mental health. But just going back, I'm talking about appearances with the snapback culture, where we equate that recovery and bouncing back strength to everything else. That they must not have depression. They must not have anxiety if they can bounce back and if they got their strength back sooner. And it's dependent on so many different factors. It can definitely be a sign of health, but not necessarily. And people can be exercising and still not look like they looked before they had a baby. I'm evidence of that. My body does not bounce back externally. Strength wise, I was pretty good usually, but my body was just much bigger and different after I had my babies for a good year, 2 years.
That because you know why? Our body does shift. And our body is constantly changing and evolving, right? And it's very normal for our strength levels and our hormone levels. And especially with fitness, we have different times in our life when we're at our peak, or when certain things are easier for us than other things, right? It also has to do with the energy and the sleep that you're having when you have a newborn. And so many different things. I mean, speaking of the bounce back culture and the appearances, I know firsthand just from different clients and women that I speak to, a lot of different types of women, that they're coming to exercise classes and they are, let's say, accomplishing these goals. But like you said, it doesn't translate all the time because they are stressed, because they're not sleeping well, because they're not eating well. Yes, they are exercising 3 times a week, but it's not reality. And also, we see a fraction of people's lives. We don't see the entire equation. And I think it's so important that people talk about that more. This whole equation, just one snap, a 15-second story, does not tell you what's going on, does not give you, first of all, the consistency that people go through on the fitness level, the emotional pieces, the mental pieces. You know what I mean?
Oh, I look back to those phases that I had postpartum when I was just also on that diet, rat race, rabbit hole. It was, it was a lot of unhealthy relationship to fitness, to health, to food, to weight that I had. And I remember that misery of forcing myself, coming from that self-deprecating place of I have to exercise today. It doesn't matter that my baby was up all night. It doesn't matter that I was dealing with other kids and that I have a job, but I am doing this program and I must exercise today, and I will kill myself to do it, however nauseous and horrible I'm feeling from the sleep deprivation, because I have to do it. I remember getting that clearance from my midwife to be able to exercise. And I'm I don't care how ready or not I am for this. I'm going to go full blast and hardcore because I have to do it, from that self-loathing place. So I remember that from myself, and I was exercising a lot, but I hated it. I was so unhappy. So,
right. Yeah. And it's because, like you said, you wanted to so badly bounce back, wanted to so badly be in that place. But if it's coming from a place of I love myself, this is good for me, this is going to give me energy, finding that piece of fitness. You don't like running? Don't run. People tell me I'm Sarah, I really hate jumping. I really hate it. So we won't jump right now. But I'm going to tell you something. I always say this. I'm but it is good for you to do cardio. So we're going to do other types. There are other types of cardio.
Yeah, I do. And I do. I do the bar that's low impact cardio. I
Right.
get nice and hot and sweaty. I'll do hot yoga too, where again, I don't know exactly how, that might be different, but I get so hot and sweaty and like working hard. And, Pilates can be like that as well. So yeah, I found that the low impact works so much better for me. I enjoy it. I want to do it. And I do it from a place of self-love where I found that movement that I love and that I enjoy instead of forcing myself to run on the treadmill, go to Zumba classes, because, I used to have this like mindset of I have to do both. I have to do the yoga and the Pilates, and then I also have to do the cardio. And I'm just so much happier that I found that good, healthy balance, and I enjoy it. And I do it from a place of compassion now. I wish I would have done it years ago.
Oh, I also look back at like old Sarah and like just after my babies. I wish I was more kind to myself. I wish I loved myself more. I wish I didn't have so much guilt and shame. I think that's the biggest thing for me. Like, it wasn't even surrounding exercise, just in general. Like, I had to look that way, right? I was the trainer. I had to show everyone that I had it together, that I was strong. And I don't care about that so much anymore. I don't know.
Well, I have to tell you, I think it might be a bonus because my favorite instructors are actually the ones that are not in your typical slender, fit, buff body. Like, they're the ones that are bigger, but they're amazing at what they do, and they're strong, and they do like crazy, amazing things. I love them the best, maybe because I don't view myself as being in that typical body, and I just feel like I can relate better to them. And it's amazing for me to see an example of that you can be doing all that stuff and strong, and you're not in this like thin, small body where sometimes this is again, total internalized feelings that I have that absolutely are not. I don't think that the fitness instructors that are slender and thin and all of that, I don't think that they're projecting this like condescension or anything toward me. But again, I think that might be a bonus for some people. They may find you more relatable, and they may want to have someone like you be their fitness instructor because they see that you're a normal human person too. You're not this like ungodly, thing that is impossible to attain.
Yeah, I hope so. I try to be relatable because like I'm a human and I'm going through it just like we all are, like, and each baby and each postpartum, each pregnancy is a different journey, right? None of them look the same. And I think that's also something very important to emphasize because we can't compare them. Well, with my I hear this a lot, Kami. I hear this a lot. With my last baby, I felt I bounced back. With my last baby, I was fitting in my pre-wedding clothes right away. For some reason, with this child, I cannot seem to lose the last 10 pounds. And we sit down and we talk about it. What's going on for you differently? Are you more stressed at work? Are you sleeping as better? Well, this baby's colicky. Okay, that makes sense. So that means you're not sleeping as well.
You also have other kids to take care of now. Your responsibilities.
4 kids at home, Kanai Nahara. Oh, that makes sense. Can you please just give yourself a little hug? Like, you're doing amazing. It's so hard. And you're still showing up. The fact that you showed up here with everything going on, holy cow. So like, I think there's also like that piece, like giving credit to where credit's due. You just had your 4th child. You're right. It's taking longer to really feel like yourself again, to really feel strong again, showing up and committing to yourself. That's where credit's due.
Yeah. I want to talk about what are the physiological changes that you see during pregnancy and then postpartum, and how exercise needs to be modified accordingly.
Okay, so that's a really good question. So pregnancy, and again, I'm learning this more and more, and things are evolving more and more. I think we're coming into this new age of like the fitness professional world is learning more from experience, right? So the golden rule with pregnancy is that what you've done before to continue doing. So if you're running, you can continue running. Listen to your body. If you're doing yoga, if you're doing Pilates, any type of exercise, but you have to listen to your body. So if you feel cramping, if you feel pressure on your bladder, right? If you feel nauseous, if you feel like it's jolting to your body. And I want to explain that because that's something very important that's not talked about enough. Jumping and, different exercises like burpees and squat jumps and things like that you might do in a regular fitness class, that adds a lot of pressure to the pelvic floor. Not really something you should be focusing on when you're pregnant. Like there's a time and place for everything, when you're pregnant for 9 months, yes, you may love doing that, but it might not be the right time for it. So I think that's important. And then again, when you're on your back, right? So when you're laying down on the mat and if you feel discomfort, then you want to go to the side. You want to come on in like a cow cat position. So it's really about every person is different. And that I'm a huge proponent of. Like, it doesn't help people when there are golden rules because everybody is different. Every body is different, right? And our histories are different with exercise. Now is not the time to start working on your core. Now is not the time to go run a 10K. You know what I mean? Like now is not the time to start doing all these crazy things. Stay with what you've been doing until it feels uncomfortable. Listen to your body. And movement is important. Think of this marathon, right? Like the baby is pushing that baby out. Having the baby is the main event. It's the marathon. So all the training up until that time, I personally, and I've seen it with my clients, like the differences between working out and not working out really translate to that main event. Not always. Some things are out of our control and we don't always know, but we could do our hishtadlus and we could take care of our bodies. And then there's the afterbirth and the recovery. How do you feel? Are you able to get up and walk? Do you feel like your body recovers better?
And just going off of what you said, one of the other considerations, I mean, there are two other things that I can also think of. One is that because our body's releasing the hormone relaxin, our joints tend to be a lot more flexible, move better, and someone can actually injure themselves if they overdo it, especially like when I did yoga. That was a big thing that I had to be careful about, not hyperflexing because then I can hurt myself more. And the other thing is the center of gravity changes. So you have a lot more weight in your abdominal, the middle of your body, and it's protruding forward. So first of all, that can cause back problems, but also it can be an increased risk for injury when you get to the later stages of pregnancy. And like you said, yeah, I mean, there are universal rules. And then there's also listening to your own body and not being hard on yourself and stopping, because pregnancy is it's a body change and it's going to present different considerations. My question to you also is when you were talking about like, it's not the time for burpees and things like that, what do you say about like core exercises? Because I know that it might present, I don't know if this is something that I just heard or if it's real, but that like in the later stages of pregnancy, it might actually increase the risk for diastasis recti. Is that anything like that?
So it's not the time to do core. It's really not the time to be focusing on core. Think about it. There's a baby in your core. The baby is literally right here on your stomach. So it's not the time, and especially if you're doing like a lot of like exercises that bring pressure to the abdominal wall, planks, sit-ups, crunches, things like that. There are a lot of exercises. So I don't want to say you shouldn't do any core exercise, but a lot of the traditional core exercises you should stay away from, specifically in the second and third trimester. It can increase the risk of DR 100%. And they've seen that. You want to hear a really funny statistic? Fitness professionals are the highest number in DR.
That makes a lot of sense to me because they're exercising more.
I'm just saying, know what to do. Go to prenatal classes. Have a trainer that can modify for you. Listen to your body. Why are you doing planks when you're 8 months pregnant?
Yeah, I mean, there's a lot of increased pressure on your muscles already. So when you do those planks and those sit-ups and things like that, so I guess that's something to take into consideration. And then this really highlights the importance of having a certified prenatal, postnatal fitness instructor, because there are modifications that you need to make, and you can injure your body if you continue doing everything that you've done before without modifying things as you get onto your second and third trimester, as you get bigger, as your abdomen gets bigger. So I think it just highlights the importance of using a certified prenatal, postnatal fitness instructor, or one that really is well versed in the different body mechanics of pregnancy and postpartum, because you can cause yourself further damage. And it's interesting. I also have to go back to what you said. I see in my anecdotal experience, I'm not sure if there's research on it or not, but I do see that people who have a very toned core, like, athletes and people who are like, who dance ballet or who are hardcore Pilates instructors and really have their abdominal muscles are very, very, very tight. I do see that this is anecdotal. I don't know if there's research about that, but I do see a higher rate of C-sections among them.
Really?
Yeah. And I think their theory is, and I've spoken to other birth professionals who have said the same, because there is something that we need to focus on in preparation for labor that we don't normally focus on, and that's actual relaxation of the entire pelvic floor and lower abdominal muscles.
I have like a super toned core in that set. Like I have a 4-pack maybe, but like not even, and it doesn't even matter. But the point is that I really struggle with relaxing my pelvic floor because I do so much exercise where I am not relaxing my pelvic floor. It's interesting. I never thought about that.
It's interesting because, everyone focuses on the Kegels, and Kegels are important. But when you're doing Kegels during pregnancy, the focus should be on the relaxation part of the Kegels, where you really need to be able to relax that pelvic floor to allow the baby to descend. And also, I do see that people who are athletic and who have that grit are usually able to tolerate labor more.
By the way, I love it. I always say, I know you're going to think I'm psycho, but I dream about labor. Like I loved giving birth because I have very difficult pregnancies where I'm throwing up for like 9 months, and I have hard postpartums, like with anxiety and stuff like that. So it's like that one highlight moment. I am like, first of all, I did my second and third without an epidural. It was amazing.
It's euphoric.
It was like, I felt like a rock star. I literally wish I could do it right now. Like, I love it.
No, because your body does release more endorphins when you're in unmedicated labor, because it needs to cope with the pain. And those endorphins really, they give you that shot of euphoria. I'm not saying that everyone with an epidural doesn't feel that, but I do see that people who give birth without an epidural have that extra euphoria. And I liken that to like after a good workout, like when you're working really hard and you're sweating a lot. And then when the workout's done, like when I do bar, we do Shavasana at the end, like when you just lay down for a few minutes and oh my gosh, it feels amazing. I also I go for the workout just so I can get that feeling at the end.
Yeah, for sure. And I always say, like, if you don't like to work out, that's fine, but focus on the part you love. That after feeling, oh my gosh, it's amazing. There's nothing like it. So I feel like for birth, I had a birth teacher. I don't know what they're called. What are they called? Like when you do like birth instruction with my first
childbirth educator.
Yeah, like it was like a little class to like what to expect type of thing. And she kept saying, she's like, I know, Sarah, you're gonna love birth. You're gonna love it. And I didn't want her to be my doula because my mom and my husband are there. It's like too many people. But I remember like after she was done, I'm like, Jody, it was amazing. I loved it. It was incredible.
Yeah. No, I do see that, just because birth is hard work. And I think that there's that work ethic that athletes or very physically fit people have, where they need to learn how to tolerate pain and how, like you said, see the positives of that. I'm curious, you said you had a lot of nausea during pregnancy. And I remember those first trimesters for me were horrific. I really was not able to exercise a lot, like really not. And I was hard on myself and feeling like, oh my gosh, I'm not going to feel good and I want to get back to it. And but at the end of the day, I had to learn to be gentle with myself. And I got back into it when I got into that golden, beautiful second trimester. I cannot imagine having to experience like the nausea for 9 months. How did you cope with that in terms of fitness?
Okay, so it was so hard. First of all, it's my job. So I just want to say that. Like, I give classes and I get paid to do it. Like, I get paid to work out. So there's that piece where like I couldn't just not work. And I showed up to classes, and a lot of times I would like throw up in the morning, take care of myself, eat something, recover. Like, it was like a whole thing. I used to get out of bed early because I knew that I was teaching a class at 9 o'clock. And so I had to make sure that like my body was fully recovered from like the trauma of it. It was really like horrible. And then I would get up and give the class. And sometimes I would feel really nauseous, and I would just instruct and use my mouth to speak. And then sometimes I would actually work out and feel better. Like, I wouldn't do so much jumping. I focused a lot more on strength during my pregnancies. I was not doing a lot of cardio, very low impact. And I was not able to run. I just wanted to share something with you. I had a miscarriage 2 weeks ago. I was 11 weeks pregnant.
I'm sorry.
Yeah. And I know it's very normal, but I want to share that experience because I was able to run a little bit. I was very nauseous. And I remember like actually it was like not from a place of self-love. It was more of like, Sarah, like you built this whole following on Instagram and like people think that you're like such a big runner. I mean, which I am, but like, I had this like thing in me that I had to continue running, and it was horrible and it was not good and like whatever. But I wasn't like, I tried to do it. My body couldn't handle it. My body couldn't handle running and cardio and things like that. It would make me even more nauseous. I remember like a few weeks ago, like a month ago, I went for a run. My husband's like, Sarah, be careful. Like, because I was always throwing up. And I came back and I was like, it felt amazing. I ran 4 miles. I've never run 4 miles when I was pregnant. Literally walked up to my front door and I was like, wow. Like it was done. I did the run, but then I felt horrible the rest of the day. So it's not worth it. You know what I mean? And like specifically with this pregnancy that I had, I really pushed myself to work out and it was horrible for me. So I think that like there's this piece. I didn't care as much with my other ones. And with this one, I had this pressure, like I had to like show up.
You have to maintain that persona that you developed on social media.
No, I was pregnant because I was early, right? So I was still like a friend who's like a big runner was like, Sarah, let's go work out. So we like worked out and like I could not for the life of me keep up. And it was like embarrassing, but I didn't want to say I was pregnant because I was like only 7 weeks pregnant. So it was like, that type of thing. But with this, I mean, I also think that like for all you mothers out there who have experienced miscarriages and the postpartum after that, because I'm in that right now, that's not spoken about at all, right?
Yeah.
It's not spoken about. The nurse who was my nurse when I had a DNC, which is so traumatic and it was horrible. And I'm not going to cry, but it was horrible. It was really horrible. It was like, you were my 6th DNC today. 6. It's so common. That means like 1 in 4 women have a miscarriage. If there's a group of 12 women, you know what I mean? If there's 3 of us that have it.
Not only that, I just want to say for people who have been fortunate not to have to experience a DNC, you can have a miscarriage and not need a DNC. I just want to let them know what a DNC is. It's surgery. It's literally getting surgery. You get anesthesia, you go into the operating room, and they just need to clear out any leftover contents of the pregnancy from your uterus. So not only is it like just painful to have to go through surgery and everything like that, but it's not spoken about. And just some people just go to work the next day like nothing ever happened.
Well, so that's what happened to me. I went to work the next day and I broke down with every client. I started crying because I was a hormonal mess. I was a mess. Like I had a baby inside of me and then it was gone, And I think that that's something that like I thank God I do have friends and sisters that like had miscarriages and they were able to talk to me about it. And I had that support, but no one spoke about it. The details of it. It's so painful. It's so not spoken about. Yeah, I had a miscarriage. Oh, a rainbow baby. Like I knew that people had it, but the details of it, what happens to you afterwards, that like my doctor told me in the discharge papers, you can go work out 4 days later. Okay, I want to tell you a story about working out after a miscarriage. Okay, after a DNC. And I don't know what it's like to take medication. I had to get the DNC. I couldn't do the medication for different reasons. So I don't know if it's different. But she, in the discharge papers, it says 3 to 4 days after you could resume aerobic exercise. So running for me is like therapy. And I was very, very sad. And it was really, really hard. And I just wanted that endorphin feeling. So even though I was cramping and even though I was bleeding, I went for a run and I felt horrible. It like literally felt like my insides were coming out. I stopped, I walked home. A few days later, tried it again. A few days later, tried it again. And I want to tell you, it was horrible. It was agony. And I called my OB and I said, what is going on? You said that I'm allowed to resume exercise. She's like, Sarah, you were pregnant and now you're not. Like you had a baby, and it was 11 weeks. It wasn't like 4 weeks or 5. Like it was a while. Your body takes time. Think about when you're postpartum after 9 months. You don't just exercise 3 to 4 days later. It's not the same thing. It's not 6 weeks later or 8 weeks later, but you have to give yourself time. You have to let yourself heal. And you're still bleeding. You're still cramping. It could go on for a couple weeks. It's not spoken about.
Yeah.
It's not spoken about. I looked for resources. I spoke to people. I couldn't find information. I just learned it all on my own the past week and a half.
Yeah. Yeah. You're so right. Like we talk about the loss factor of a miscarriage, losing a pregnancy and how sad that is and how hard it is. But we don't talk about the physical recovery that needs to happen after miscarriage and the fact that you're bleeding and cramping for weeks afterward, but you're just going to work. And most people they don't talk about having a miscarriage and having a DNC. And so they are just, pretending like they're carrying on with life while not only are they emotionally mourning the loss, but their body physically is like a daily reminder, the pain and is a daily reminder of the loss. And I'm so sorry that you had to experience that. And thank you for taking that hard experience and turning it into something that can give other people some validation and feeling like they're not alone.
I think that the reason why I even share this with you is because like what I said, even though I had emotional support, and I did, Baruch Hashem, I'm very grateful to have had the emotional support of friends and family. But there was not a lot of support. I didn't even know about like exercise. I didn't know that my body would cramp for 2 weeks. I didn't know like what you just said. Like I just didn't know it. And I want to be able to help people with that. And also postpartum, I feel like I'm postpartum now, by the way, but I am in a different way. I feel like, again, with fitness, I have to be careful. I have to make sure to like give my body that grace, ease back into things. So it's important. It's important. We women go through so much in these birth years, right? From the age of 20, I don't know, some people have babies as early as 20 to 40, really. These days, women are having, so these 20 years of like just the prenatal and the pregnancy and wanting to have a healthy, strong pregnancy, and then the postpartum, and making sure that you're taking care of yourself mentally, emotionally, but physically, not being hard on yourself, and giving yourself that love and accomplishing those goals, going back and forth, and in the from world, having one after another. So I just think we need to talk about this more. And I love that you brought me here to talk about it, because you don't hear it. Definitely, you don't hear it.
No, you're right. You really, really don't. You really don't. And then you hear the stories later on of somebody who had that difficult experience of like just needing to carry on and be there for their other kids and go to work and see the rest of the world and say mazel tov to someone who just had a baby who doesn't know that they just suffered a loss. And yeah, that's really hard. And it's such an illuminating consideration for when we talk about prenatal, postnatal fitness, perinatal, because this definitely is, I think, a subcategory of that. So
I mean, I think it's a big category. I mean, Baruch Hashem, there is a lot of birth, and it is so beautiful, right? And people are having children, and it's amazing. But there are a lot of people suffering with miscarriages, and miscarriages is also being pregnant and postpartum. It is. It is.
Yeah. Yeah. Yeah, it really is.
Part of life. It's not, it is sad. I'm not going to like pretend like I'm okay and I'm not sad. I am. It's very hard, but it's not, it is part of life, meaning there are ways to triumph with it. There are ways to recover and heal and still be able to take care of our bodies throughout it all, and I want to preach that. I want to be able for people to hear that and to be motivated by it. Like, we can find movement, joy and movement in all of these stages. We owe it to our bodies. We owe it to our bodies. I say this all the time. Hashem gave us a neshama, and we have one body to house it, right? And it's our responsibility to move it and to celebrate what it could do. Oh my gosh, it could do such beautiful things. We're so lucky. Those of us who are mothers and are able to go through healthy pregnancies and strong births and postpartums. So we have to celebrate it, moving it in the way that we love, in the way that helps us accomplish our goals. There's nothing wrong with wanting to lose weight. There's nothing wrong with that. Do it from a place of love. Do it from a place of, because I love my body and I want it to be strong and have energy for my life.
Yeah, for sure. For sure. And people tell me all the time, like, I just feel like I'm not me anymore after they have their baby, because they felt like they had more energy, like they were stronger. They felt different, and they want to get back to that place. So yeah, for sure. It's really, it's true.
Be realistic, like, you can not bounce back. You can go back there. It's a journey.
Yeah, I like to say you can heal back there. Nothing's ever going to be the same for anyone who becomes a mother. Your entire psyche changes, your entire outlook on life changes, your values change, your heart changes from an emotional place. Why do we think that the only exception is going to be your body, and that it should go back to the way it was pre-pregnancy? Even people who tell me, like, who have gone back to their pre-pregnancy weight, their clothes is still not going to fit them the same. Their body's still not the same. Their hips stretched in a way that is not going to reverse back to what it was. And that's okay. Why do we expect our body to go back to exactly the way it was when the rest of our lives are never going to be the same? So, I like to look at it from that place.
I love it. Back. You can heal back. I love that.
Yeah, no, you can heal. You need to heal. Your body needs to heal. And by the way, going back to what you said about from culture where people are having very large families, and if you're surrounded by that, then you can feel a lot of pressure. I even remember with my first two, they're 18 months apart. And I remember feeling that pressure. Like, everyone around me was having a baby a year after, their second baby was being born a year after their first. And like, so why did I feel so tired? And why did I feel like I can't do it? I should be able to do it too. But take the time to recover. If you feel like you need it, take whatever time you need. And it's healthier. People have healthier pregnancies when their bodies are recovered, and they have better outcomes when they wait that 18 months to 2 years for their body to recover and not bounce back to what it was pre, but to recover. So Sarah, thank you so much for joining. We're coming up to the end of our interview, and I wanted to ask you if you have any other important messages that you'd like to leave our listeners with. You really talked about so many important, amazing, incredible things. Do you have anything else that you feel like it's important for people to know?
First of all, thank you for having me. I love this conversation. I think that the way that one thing I want to leave you off with is you can accomplish your goals. You can, if you want to believe it, if you're willing to do the hard work, and if you love yourself, you can totally accomplish anything. I don't have a doubt in my mind that you can do it. Pregnancy, postpartum, these are beautiful times. They are. They're hard, they're messy, but they're beautiful. And if you want to accomplish different goals, then you can do it. So, yeah.
Yeah, from a place of love, from a place of purpose. Yes, it's so true. Yeah, exactly. From a place of intention. Thank you, Sarah, for joining us. And thank you again for all of the amazing, amazing wisdom you had to offer here. Thanks for tuning into the Happy Birthway podcast. Head over to Yoledet Academy on Instagram to continue the conversation. You'll find the link in the episode show notes, as well as links to any additional resources, products, and services mentioned here. If you love listening to the show, you can help it grow by sharing it with your friends and rating and reviewing it. To stay in the loop when new episodes are released, make sure to subscribe. Remember that your health needs are unique and require individualized medical advice. The podcast is not a replacement, and some of the information may not be appropriate for your specific circumstances. My mission is to educate you so that you can confidently collaborate with your healthcare team. I believe that a healthy mom and healthy baby are simply not enough. We also need a happy mom with an empowering birth experience.